Imagine a pregnant woman decides to do a prenatal screening test in order to determine what genetic disorder her fetus may be predisposed to. The results come back and show that there was a mutation in the COL1A1 gene, which was inherited from the parents. The mutation is a sign that the infant will be born with one of the types of osteogenesis imperfecta. Osteogenesis imperfecta is a genetic disorder in which bones fracture or break easily. Sometimes these fractures happen for an unknown reason. This disorder can also cause weak muscles, brittle teeth, a curved spine, and hearing loss. When the COL1A1 gene is mutated or doesn't work, it affects how the body makes type 1 collagen, a protein that helps make bones strong. Osteogenesis imperfecta is categorized by bones breaking easily due to a genetic disorder. People with this condition experience bone fractures often, and this is only one of the many symptoms that are associated with the disorder. Soft and brittle teeth, muscle weakness, and a curved spine are just some of the symptoms children and adults with osteogenesis imperfecta encounter. Furthermore, some more evident symptoms are bone deformities, such as bending of the legs. This occurs because the bones within the legs support the entire body when standing upright. And due to osteogenesis imperfecta, the femur and the tibia are unable to support the weight of the body. This results in a bending of the legs and can bring about severe pain. Some other symptoms associated with the genetic condition are barrel-shaped chest, loose joints, and skin that bruises easily. There are also other symptoms that are significantly more visible, such as discoloration of the sclera and a triangle-shaped face. The sclera is the white part of the eyes, and in the presence of osteogenesis imperfecta, the white part turns gray or blue. While osteogenesis imperfecta impairs structural integrity of the human body, it can also cause hearing loss, since the sense of hearing is based off the vibrations that occur in the malleus, incus, and stapes bones. These three ossicles are the small bones within the middle part of your ear that create the vibrations, which are passed on to the cochlea. Osteogenesis imperfecta affects strength and structure of these bones. There are four main types of osteogenesis imperfecta. Type 1 is the most common, and more fractures occur during childhood and adulthood. Furthermore, some children may experience hearing loss. Type 2 is more severe than type 1 and include underdeveloped bones at birth. Infants are usually born with soft skull bones. Type 3 is very severe, with infants likely being born with broken bones, poor muscle development, and a curved spine. Treatment is required throughout the lifespan of an individual. Type 4 can range from mild to severe, with most individuals experiencing fractures before puberty. These individuals are shorter than average and often have bowed legs and a curved spine. Osteogenesis imperfecta can be diagnosed at different stages of life: prenatal, at birth, during adolescence, and rarely in adulthood. The disorder can be detected in fetal development via an ultrasound or by taking family history or lab tests. Ultrasounds as early as 13 to 14 weeks can visualize severe osteogenesis imperfecta type 2. Week 16 to 20 can show type 3, and occasionally week 20, type 1 and 4 can be identified, but are not usually reliable. Since osteogenesis imperfecta is an inherited disorder, lab tests such as genetic testing is helpful in observing any genetic variations. Parents with osteogenesis imperfecta have a 50% chance of passing on the disorder, whereas if a sibling has it, the chances are between 0 and 50%. Oftentimes, if a genetic test is performed, families are sent to a genetic counselor to help them understand the results. When diagnosing infants or children after a physical exam, typically done first, sometimes mild cases can be overlooked due to the different variations. And in that case, other doctors should be seen, preferably those that are experienced with osteogenesis imperfecta. Osteogenesis imperfecta type 2 and 3 are typically identified at birth due to a physical examination or an X-ray. X-rays provide visuals for any deformities, weakened or fractured bones. If a child experiences unexplained fractures, it may indicate osteogenesis imperfecta, and a genetic test can confirm a diagnosis. Unfortunately, there is no cure for osteogenesis imperfecta. However, there are methods to manage or prevent symptoms. Management and prevention include medication, physical therapy, surgery, and braces or fracture care. Medication like bisphosphonate is prescribed to slow down bone loss. However, it will not build new bone. It is also linked to reducing compression of vertebrae and fractures of some of the long bones. Weak muscles are also correlated with this disorder, therefore cause a delay in mobility. Physical therapy can help maintain function of these muscles to lift arms and legs, as well as promote independence. Braces work to provide support to muscles and joints and decrease pain, permitting an increase in motor skills. Fracture care, such as splints, casts, and braces, are forms of management of bones that are already broken or experience deformities. The downside to fracture care is if bones are left in the same place for too long, it could be detrimental. Therefore, there needs to be a balance between healing and maintaining strength. In some cases, surgery such as rodding may be needed. Rodding is a common surgery where metal rods are placed in the long bones of the leg, and in some cases, the rod may be longer to leave room for growth for those that are still growing. Metal rods provide strength to the leg and prevent fractures. Other surgeries work to realign fractures and fix deformities such as an underbite or overbite correlated with the jaw. Due to osteogenesis imperfecta being correlated with other conditions, it's common to treat hearing loss with hearing aids, crowns for weakened teeth, and oxygen for those that have breathing complications.